So, chairs, Worrell, members of the committee, thank you for having us today. My name is Dave Rini. I'm the Executive Director of Prisoners Legal Services of Massachusetts, the statewide legal service provider for folks who are in custody and our Massachusetts correctional agencies. I want to extend my sincerest thanks for hearing so many voices from inside today. We know how important and powerful that testimony can be. My job today is to share a little bit about the connective tissue between the four bills that we are combining together, what we're calling our Dignity and Freedom Platform, as Rep. Worrell read out before. And the theme that we think connects all of them is what we're calling true public safety, the ability to make sure that folks can come home, reintegrate into their communities effectively, and do so with low recidivism. The committee has a choice between ineffective punitive policies that we've seen or supporting things that make our communities actually safer. It can be easy for those of us on the outside to forget at times that people in prison are still our neighbors. When we think about the rules that govern how they're treated inside, if those laws don't prepare folks for coming home, that's not creating true or lasting public safety. Example, Susan Baranowski Correctional Center, which you've heard folks speak from today, it's our maximum security prison, releases more folks home to the community than any of our other correctional facilities, but the environment in which folks held in that facility are living is so different than any experience they will have when they're coming home. They're being conditioned to live in a way that is not sustainable for them when they release. We know that being able to access programming, mental health treatment, meaningful out-of-cell time, socialization, all of those things are necessary to reintegrate back into a community. Places like SUSA don't allow that. The Human Rights Bill seeks to ensure that folks inside have access to real self-improvement and socialization. And you heard today from so many people about how important that self-improvement really is. We also know that limiting people's ability to maintain ties with their family members and friends doesn't prepare them to come home either. DOC Commissioner Jenkins has spoken at great length about how important visitation is, but the DOC's new policies have cut visitation by close to 2/3 since they've been implemented. The visitation bill emphasizes the importance of those visits to anchoring people to their communities and ensuring their connections are strong when they are ready to come home. We have the oldest incarcerated population in the country, and it's neither cost-effective nor valuable for public safety for our correctional facilities to serve as nursing homes and hospitals. They were never designed to do that. The elder and medical parole bill would find ways to get people into more appropriate locations for treatment when they're no longer a risk to the community. This bill isn't a free pass for folks to come home once they hit a certain age or medical status. It's really desired to ensure that folks who are no longer a threat to anyone can live the rest of their time in a reasonable location. And lastly, injustice is an active threat to public safety. We know that. Black and brown prisoners are subject to unfair treatment inside, even by the rough standards of correction. But our correctional agencies don't keep any data, successfully sort of maintain data on racial policies. This bill would require that, as well as create the independent office you've heard so much about. We urge the committee to consider true public safety, what's going to happen with folks when they come home, and report these bills out favorably. Thank you for your time.
Thank you. Any questions?